Welcome to the Crossing Borders podcast. I'm your host, Julie White. On this show, my guests and I share information to help foreign-trained health providers find their way into meaningful careers in the Canadian healthcare system. Let's get started. All right. Welcome back, everyone. I am so excited today. I have a special guest with me, Amoli Jadhav, who is a Master of Science student in the Healthcare Quality Program at Queen's University. Amoli also works as a referral coordinator at the Kingston Health Sciences Center. She is a graduate of a postgrad healthcare administration program and previously was a medical officer in India. She came to Canada in 2017 and has really continued to grow and flourish. She's somebody that embodies lifelong learning. She's got incredible energy, resiliency, and usually does whatever she does with a big smile on her face. Oh yeah, and she can do it in 4 languages. So it is a pleasure for me to welcome Amoli Jadhav to the conversation today. Hi, Amoli.
Hi, Julie.
How are you doing?
I'm good, thank you. How are you?
I'm fantastic. So excited about our conversation today.
I'm excited too, and thank you for that wonderful introduction.
No problem. All right, we're going to start with a kind of a rapid fire series of questions just to get you warmed up and to warm up our listeners to get a little bit more insight into who you are. Are you ready for this?
That sounds great. Yes, I am.
All right. Road trip, hiking, or bike ride?
Road trip.
LinkedIn, Instagram, or Snapchat?
LinkedIn.
Such a professional, aren't you?
I try. No, I enjoy LinkedIn.
Excellent. Okay. Shopping or learning something new?
Learning something new.
Books or videos?
Books.
Dogs or cats?
Dogs.
Tim Hortons or Starbucks?
Tim Hortons.
Cooking at home or dining out?
Cooking at home.
Early bird or night owl?
Night owl.
Ice cream or cake?
Ice cream.
Groundhog Day or Valentine's Day?
That's a tough one. I would say Groundhog Day.
All right. Groundhog Day or Family Day?
Family Day.
And that's because you get a day off with that, right?
That's true.
Awesome. And one more question that I didn't, that takes us a little bit away from this structure. What's your favorite place to go and relax and rejuvenate?
Just going and sitting by the water. So it could be Lake Ontario Park. Yeah, that's what I can think right now. Lake Ontario Park.
Another grounding by the water. It's amazing how many folks really kind of get attracted to that water. All right. So can we start off with you telling us a little bit about your story and what it is to be a medical officer in India and kind of what difference that looks like now that you're in Canada?
Yeah, sure, of course. So I have a bachelor's degree from India in medicine and surgery with a major focus on traditional medicine. Throughout my medical academics and clinical rotations, I have studied and applied basically the knowledge of both Western and traditional medicine. And after completion of my studies, I started in a position as a medical officer for a multi-specialty hospital in India. And during this role, I would say that my main areas of focus were working in intensive care unit and step-down ICU. With the job role as a clinician, I had to closely work with the administrative section of the hospital during this time as well. And the reason for that was because I participated in various teams within the hospital, and I was part of the quality improvement team. And not just that, but I was also maintaining the medical errors data and kind of providing a bit of analysis, what I could at that point as a fresher in the field. And I think that's that was kind of a very interesting thing for me to learn more about policy making. And because of that, I kind of chose my future career, which I deviated a bit from the clinical sector into the administrative role. And chose the hospital administration route or path for my career. Of course, the main difference I would say between the both is I do miss working at the bedside as a clinician, which I can't do in the administrative role. And I think that's one of the biggest difference that I face. However, that still doesn't stop me from providing a patient-centered care from whichever current job roles that I am in and that I will be pursuing in the near future.
I imagine your roots in providing that kind of hands-on bedside care are really essential and will really help you in envisioning kind of what those quality improvements and what that data means when you're thinking about the numbers. You're seeing faces.
Yeah.
Aren't you?
That's correct.
Excellent. So it sounds to me like kind of the roots were planted for the work that you're studying right now as well, long ago. And you've been in Canada now for 5 years.
Yes.
So can you talk a little bit about why you chose to come to Canada specifically? And you've got everywhere in the world if you want to go to another country. Why did you choose Canada?
I would say one of my dreams was that I wanted to continue my higher education in the areas of my interest in a Western country. And, it's always that the grass is much greener on the other side. And throughout my academics and in my working roles, I had read a lot about healthcare in the developed countries. In addition to that, I think one main thing for me was that I'm a strong believer that being resilient will always bring the best out of me in the worst possible situation. And that's why I wanted to move to a country where I had no family or friends. Because with that, my personal belief is that would really fuel what I'm passionate about, and it will help me just achieve the goals that I have with that burning passion. And as I said, I have no family or friends in Canada. And when I had a couple of options and I did some more research, it just came down that I chose Canada. But the whole idea was basically that, yes, I want to learn about healthcare in a developed country. However, I want to move where I have no family or friends.
Okay, excellent. And what was your first impression when you got here?
I was just amazed. I'm like, this was my dream to just move to a Western country, and I have done it. So, I was just proud of myself. I'm sure, my parents were proud of me, but I was super proud of myself because I think maybe that was one of the decisions where I just felt like I haven't made a wrong decision. I was just thrilled to just arrive in Canada, and I was just very proud of myself.
All right. And when you looked at that Canadian healthcare system, I know we've discussed in the past kind of how Canada's always tried to situate itself as having like one of the best healthcare systems in the world. And you get here and you start to see, oh, wait a minute, what's going on? What are your impressions now when you look to our healthcare system?
I would say it was different when what I read about it, but what I'm experiencing within our healthcare right now. And there are a lot of opportunities. I don't think opportunities is the right word, but there are a lot of issues that need to be fixed to actually say that we have the best healthcare. And it could be just and during the pandemic, it's not that we never had those issues. We always had them, but they were just amplified during the pandemic. And if we were able to still pull it through the pandemic, I feel that those are the issues which can be fixed in some way or the other. And we do have those resources. It's just how we can use them to make it a better system.
Excellent. And it is all about improvement of the quality of healthcare that you're studying right now. So do you want to talk a little bit about what you're doing with the master's program at Queen's University and kind of why you've chosen that stream and a little bit kind of leading up to, what made you decide to take that program as well?
Yeah, of course. So I am a current student at the Master's of Science in Healthcare Quality program at Queen's. As I said that when I was even back in India, I was part of a QI team. And I had just started to learn a little bit about the various process improvement methodologies, or how to cultivate your organization's culture, why it is important to understand the human factors in healthcare, and how all these things help you in having a better patient-centered care, in delivering better patient-centered care. However, still not ignoring the fact that continuous improvement is part of innovation and understanding or learning new technologies to help our patients. And of course, patient is always the main picture in anything that we do in healthcare. However, in order to have that greatest delivery for the patient, you need to have a good functioning organization. And in order to execute anything within big organizations or just in general healthcare organizations, I feel personally like there could be a lot of clashes between different set of individuals, depending on their qualifications. But the underlying thing is all are passionate about about providing and delivering good patient-centered care. So if we have the same passion, what is it that's holding us back to deliver that? And I think that was one of the things when I looked at the Masters of Science in Health Quality program. And this program touched bases with, not just like why is it important to have quality, patient safety, and why is it important to understand risk within healthcare organizations, but also like understanding the other aspects of it, like organizational culture, human factors, the different process improvement methodologies that you can use. And I think that that's the main reason that I chose this program. And of course, I can still work full-time and have a part-time master's program that I can, it's very, not, I wouldn't say easy, but it's manageable at this point of time for me. So, those were the reasons that I chose this program. Sorry, it was a very long-winded answer.
It was a perfect answer. In terms of what you're learning right now, what's kind of the biggest wow that you've had? What's the thing that's made you go, oh, wow, this is important?
Yeah, so I'm still in my first year. However, I think one of the programs that really, I really had that moment was when I was learning about process improvement methodologies. It's like we do these things, we already have these in place at the organizations, but we just don't know that, oh, this is what this was called, or like, this is a methodology that we already use, but it's just that we have never seen it from a different angle, which if we would have, then we would have fixed another problem. So I think it's understanding not just the practical aspect of it, but also understanding the actual theoretical um, uh, methodologies and that will help you use it in various situations and help fix a problem. Or, yeah.
Awesome. All right. And you mentioned that you're working full time as well. So you're working at Kingston Health Sciences Center, is that right?
Yes, that is correct. Um, so I'm working at KHSC at Kingston Health Sciences Center as a referral coordinator in one of the programs.
All right. So probably you have a lot of quality improvement and various projects even within that you could certainly practice and run.
Yes, that is right, actually. And my job role is more like administrative. So when I take this information that I learn from my master's program, I try and apply that within my administrative role to see how we can make a better process change if there is, or just improvement, not a change, but improvement, like how we can improve it. Because I feel like in an administrative role, when you're trying to work with an administrative team, to see those results, it's more challenging versus when you see in a clinical setting or the process improvement that's done by clinicians or, other registered healthcare professionals. So it's different to see the results like on the floor, and it's actually different to see the results just on workload basis in an administrative position.
Excellent. Good. So you have had many different experiences since you have arrived in Canada.
Yeah.
Can you talk a little bit about the difference in education? So between the college program, when you took the postgrad college program versus now doing your master's program, what does education look like differently there?
Um, For me, the main difference between the two was, of course, my college program at St. Lawrence was a full-time program, wherein also along with that, I was still trying to figure out what I wanted to do, where I wanted to head to, right? So different priorities then. But in my master's program now, I kind of know the direction I want to be in. However, saying that St. Lawrence College, my program as a healthcare administration, I think that was kind of laying a foundation to understand the actual working of a Canadian healthcare organization. And now in this master's program, I'm diving deeper into actually understanding how it works when there is some process improvement. Like it's linking more like theory and practical knowledge together in my master's program. Whereas when I was doing my college program, it was more I was doing theoretical aspects. I was learning the theory more, and I had less practical linking between the theory and the practical with the course. And of course, like this is part-time over the course of 2 years. And I had, for my college, it was a full-time 2 years. So
Okay,
I think
good.
that certainly makes a bigger difference.
Yeah, and you were really kind of general with the college pieces and kind of learning a lot about the system in general, right?
Yes, that's true. And just along with that, just the shift from a different country, I think just accepting stuff, accepting the things as they are, and just the cultural differences, and just embracing all that. When I just came as a student, and now I'm like, I kind of know what to expect when some things just happen the way they do. So yeah, those were a couple things that I found were different between my college and my university now.
That's really fair. And in terms of finding that role, where do I fit in the healthcare system? What do I want to be? You mentioned that kind of in your college days, you were doing that struggling piece of what do I want to do? Do I want to do this or that? Can you talk to me a little bit about the things that you did to test out different areas, or to think about different areas, and kind of what I'm getting at is trying to find what are some of those tips and tools that current students could maybe use to figure out what is their path? What do they want to do?
Yeah, and uh, that's a great question, Julie, because I feel now that I'm following the St. Lawrence Healthcare Administration group as well, um, I think one of the biggest opportunity for them to actually know what they want to do is their capstone projects. In that, you you can really understand how to network yourself um, and within the different healthcare agencies. And that piece is very important. And I like how they're doing like a group project, like a group capstone, because it's always for improvement. It's always necessary for it to happen as a group than happen as an do it as an individual, because we can always have more knowledge, more respectful, healthy discussions. And I think those lead into some great ideas, which will probably help you to pave your path and go ahead in the direction that you would like to. But yeah, I think for me, if when I look from a hindsight now, is like, oh, I wish I would have done this in my capstone. Like, why did I not do that? Because that would have helped me probably gain what I'm getting now faster than, a little late in life that I chose to go to master's. So, but yeah, I probably would have done that earlier. Or I would say another thing is that if they already have a plan what they want to, if like they want to do their certifications and get those things started, try heading into that direction as soon as possible, because it's mostly like the administrative part to attend those certifications might take longer. And I feel when you're a student, you still have that control over the time because you're a full-time student. So try doing that earlier if possible. If when you're looking for different jobs in the field, see what they're actually looking for. Read the qualifications. And it's, as an international student, I feel like you may already possess those qualifications. However, it is always good to have a certification. So using LinkedIn Learning, that's what helped me a lot. When you have time, just do like your Excel, get to Excel. I think there are different levels of certifications, learn it that way, because now in day and age, I feel like data speaks a lot, and doing data sets and interpreting it is very important. And as an administrator, if you want to lead a team, you need to have good data and good interpretation of a data to lead the team, because those numbers speak a lot.
That's great advice. So you're talking about different programs that or different courses that people can take on LinkedIn Learning. There's more on Coursera and things like that. So Lean Six Sigma, project management type, agile.
Yes.
Are those things that you're thinking about?
Yes, that's correct. And sorry, I didn't mention that, but that's one of the things that I did. I'm currently a certified associate in project management, but I'm studying towards my PMP, which is project management professional certification. And the reason I had to do the step 1, which is the CAPM, is because I didn't have enough experience in a leadership role to answer my PMP exam directly. But that's one of the great things. And Lean Six Sigma, that was one of the, again, interests for like my area of interest to learn about process improvement methodologies. And that's what I started during COVID because I had lots of time. And I was just like, I got to utilize this in a good way. And that's when I started my Lean Six Sigma, and I completed that. And that has really helped me even in my master's program now, and it is still helping me. So just it's more of like you have to do your self-study to see, but once you get started, things will just come to you, and then you just pick and choose what you would like to do and just keep building a strong resume.
Great. And that's also a great way to test out different roles and places that you could fit into the healthcare system as well. I think that there's an awful lot of students who don't understand necessarily that there are jobs for a lot of things within the administrative realm that exist that they're maybe not even thinking about. So
Yeah, that's right. And I would say as um, coming from a clinician background or working like as a clinician, right? I'm like, when I came here, I was like, well, I don't want to do this job in the hospital. I don't want to do that job. I think that's where I learned that I can pick and choose because right now I'm not even in the system to see how it works. So when I started at the hospital, I started in a registration clerk position, and I don't think I would have if I wouldn't have taken up that position at that time, and if I would have just, no, that's not for me, I don't want to do it. I think we need to keep away that attitude and have more of a open mentality to get in this system and start from the roots up. And you have to build yourself to and work on yourself to go in different positions, because there's just so much of competition out there, and there are a lot of there's just a lot of competition, I guess. So it all
getting your
depends
toe in the door
yes,
is
that's
yeah,
the
getting
right
your
way you said it. Yeah, that's very important. So whichever positions, because I see when I talk to some of my friends, I think that's where it's the biggest hindrance is that I don't want to do that. You need to give it a try to see how it works. And if it doesn't work for you, there's always some different rules. If it's not within within the hospitals or urgent care, you can always shift to a long-term care and see how that runs. Like there are just so many opportunities. You just need to give it a try. Yeah.
How long did it take you to get into a full-time role?
Probably just a month or two.
So
I
the
started
demand
as a
is there.
Yes.
The need is there. And when you're a part-time or when you're accepting a temporary, maybe part-time role, they're going to see who you are, how you work.
Yes.
Do you fit in the organization? And if you do, you're going to have access to internal postings and things to
That is
move on.
correct. Yes. There is a need. I feel there is always, we can never have enough people working in healthcare. And you said it absolutely right. There's a need. I couldn't have said it any better.
So there's a reluctance sometimes to apply for roles that we may see are potentially beneath our abilities or totally different than what we see ourselves working in as our future. But building those skills, so making sure your typing skills are good and being able to, use Excel or being able to use databases and things is really important. So you see how you start to build these layers, and now 5 years later, working full time in a part-time Master of Science, degree, and going to graduate from that. What types of roles are going to be open to you once you've graduated?
Mainly my focus is like maybe in a patient safety coordinator's role, or I would put it this way, that I really would love to lead a team, but while leading a team, my major focus, I want to focus on the organizational culture and human factors. That's right now, that's what my interests, I'm really interested in learning that. And I think the reason for that was just during COVID, though, the way, we were talking about staffing shortage and burnout. I think it's really important for our folks who are now leaving the industry, because as a result of that, I take it like it's upon us to make it a workplace a better place for them so that they don't feel like leaving it. So I think that's one of my goals. However, with that, I can also probably go like maybe in a leadership role. Well, leadership is a very broad title, not like that leadership, but move into a leadership role within the organization from where I am now. So hopefully it will take me, a couple of steps up towards leading some teams. Yeah.
I see, I look at job postings all over the place and I see so many opportunities for somebody that's got your background. And once you have that education in project management as well, project and quality tend to go hand in hand. And there are so many roles, not just in hospitals either, but in, if we look at Ontario Health, and when we're looking at some of that system change.
Yes, that's right. And again, I meant to mention Ontario Health, but it's not just within like the hospital organizations, but also like um, Ontario Health or like Health Canada. Um, I think a lot of opportunities, like a lot of doors would open for me if, after I graduate. But again, for me to get through to those opportunities, now is the time that I need to actually start working more, right? Because I feel like it's like the opportunities are there, but how am I going to be different so that I would be the one who would be accepting that position? So right now, I'm currently working on some uh, mini projects that hopefully will add on to my resume.
Excellent. Building those skills and being the one that will put your hand up when there is, a special project that's coming up at work to say, hey, yeah, I'll help out with that or I'll participate in that.
Yes, absolutely. That's important. And it's funny because, Julie, I never was a huge fan of using Excel. Never. And if you see my job profile now, or like even what I'm learning, I heavily work in Excel. So that's one of the things, right? Like I may just put it on the back burner. I did put it on the back burner that I did not enjoy working in Excel. But now I'm like, well, that is kind of my lifeline when I'm working, when I will be working in quality. That yeah. So yeah, you need to just know when you know your weakness, I think some or the other way it comes to you someday and you have to learn to master it.
Awesome. And you've turned a weakness almost into a superpower then.
I wouldn't say a superpower, you're just being too nice. No, but I'm trying my best to be in a better position with my weaknesses. I'm
There you
working on
go.
those.
And that's the important thing, right? It's this constant lifelong learning and being willing to accept change.
Yes.
Change management when we're talking about culture, especially of organizations, change management is a huge piece. And you know, organizations are living things. They constantly
Yes.
need to change and grow. It's heartwarming to hear you talking about being the person or being part of the team that's helping improve the organization for those that have been in it for a long time that are feeling really beleaguered
Yes.
after the pandemic and things. So that just makes me go, oh,
Oh.
that's amazing. That's awesome.
Yeah, yeah, and I say that because I'm like, I feel healthcare is one of the industry wherein like, when we let go of our folks who are actually working bedside, there's a lot of knowledge and experience that goes with them. And we want to always retain what's the best, right? Like lessons learned are always there. However, those work ethic that they had in the I just call it the previous days, and more experienced folks out there within the organization, like, you want to retain them if they're leaving because of the reasons like burnout. And I think, and I think I don't know, I'm just being very passionate about that because I'm like, if I'm in the hospital tomorrow, I want to make sure I would receive the greatest care. And it is from experienced people, right? I'm not saying that freshers are not experienced, but they are gaining experience. They, of course, need to learn that. But a fresher can't learn from another fresher. You need to gain that knowledge, not just from a theory, from the practical aspect, from an experienced professionals. And yeah, that's one of the things that it really makes me sad when I'm like, we don't want those. How can we retain? But that's what the area of interest that I have developed recently while I'm learning my master's program.
Excellent. Wow. These are like um, incredible insights, and they really speak to kind of who you are as a person as well. I know you've been building these, over probably the course of your lifetime, and where you continue to grow, and it's just going to be absolutely amazing. But right now, in terms of when we're going to go back to your arrival days in Canada,
Yeah.
when you started kind of your post-grad program at the college.
Yes.
What was kind of your life like with part-time roles and volunteering and things like that? What did you do to kind of boost your skills at that time?
Yeah. So I did apply in a lot of roles within the healthcare organizations within the city. However, I wasn't lucky enough, unfortunately, that I got accepted in any of those positions. So I had to kind of shift gears and move into a non-healthcare industry, where I worked as a part-time for, I would say, for 2 years, because when I had to make that decision of working in a non-healthcare industry, I think there was a lot that I had to think about, because I was very stressed about, I don't want to waste these 2 years of time, or whenever I get another role at the healthcare organizations within the city. And so what I started doing is I started working towards my permanent residency during that time. And of course, that's another thing with the IRCC, with the immigration, is that things keep changing every day. So every day was a day where I was like, okay, what I'm doing today, is it going to help me towards the PR, or should I be changing and shifting gears again? So I stayed in the role that I was for a good 2 years, and it was part-time, and then after I graduated, I did a couple of months of full-time, and I just used that experience towards my permanent residency application. So that's how it went for me for my part-time roles. During the time volunteering, I would say I did volunteer at Providence Care for a couple of months, because again, they have certain intakes, right? And orientations. So by the time I was accepted in that, in the volunteering role, and we had orientation, I was almost done with school. I was working towards my permanent residency, so I need to have full-time hours. However, yeah, that's how my volunteering roles was. It lived short. However, if it would have lived longer, I probably would have ended up in a role at Providence Care. But I think it's easier to talk from hindsight. But at that point of time, I was really worried about getting my permanent residency, and I just wanted to visit my family. So I wanted to get that thing out of the way so I could just go visit my family.
How did you crack into the healthcare system?
So it was during COVID. When I was again doing my research for more jobs. I came across a job posting with Kingston Health Sciences Center with their satellite COVID assessment center, which was run at Beach Grove, and that's where I started with KHSC in a role of a registration clerk. However, within the role, I think I learned way more than what my job title was. And that was a motivating factor for me. because I was doing everything I could. It was just the need of the hour, right? Like, if there's nobody there to do like the administrative role, or like the clerical role, like I just always make sure I made myself available. And because of that, I just got to learn a lot. That's when I actually started having feeling like, you know what, I think like I want to do masters. I think I like doing this, like this change management, how it was coming, because every day was a new day during COVID with new rules, new information coming down the pipeline. And I think it was COVID which actually really helped me. COVID was another reason that actually really helped me to get me into my master's program, for me to just develop that mindset, and just feel that passion again, as to what I wanted to do.
Excellent. And I know when you were working there, you were under the leadership of the amazing Cindy Bolton,
Yes.
who probably helped out. So talk to me a little bit about networking and what relationships mean.
Cindy Bolton, she's an amazing person, just amazing. And it's again, it goes back to, right, how networking in the sense is like, I just made myself available for when there was something needed to be done from my end. And I was like, and just asking, I was curious to know about how the processes worked. So, and I think I probably asked her so many questions throughout the whole time. And then she kind of knew, or like, she's like, okay, this is what you're interested in. I'm like, okay, this is what I'm interested in. What can I do? And then I think that's when I was like really high focused whenever I had chance to do like LinkedIn learning. I'm like, okay, this is what I want to do. And she's like, well, you can try. I mean, it's not just Cindy, but like my other leaders, even with her, but she was my main leader. And they were like, well, you could try maybe this different position and see if that works for you. And then I would again do some research and pros and cons. And I was like, okay, but I think it's the open dialogue that I was able to have with them and just express what was on my mind. And actually keeping them informed of what I'm passionate about and what I want to do in future, really helped me to kind of again pave my path and try to head in the direction that I want to be. And also within that role, right, because I was being transparent with them with where I want to be, they were able to get me to the different departments, or like get me connected to the different individuals that I needed to understand how it works, to understand what is required in a specific, job role, or how you can be different, and that how that would help you to be probably a stronger candidate. So that's how I would say networking really helped me. And of course, like LinkedIn is another platform that I really used for networking in this sense, is that, whatever interests me, let's say, for instance, it's organizational culture. Once I started following, and it came from network, right? So it's like let's say if I saw somebody on Julie, your profile, somebody tagged in, and I'm like, oh, this is interesting. And now, we just start following because our thoughts align. And that's how your networking just keeps on just, not adding, building. That's how you start building your network, right? And I think that's all I did for networking. And I think within an organization, when you really want to network, it is very important to be a bit transparent with your goals. Because if you're not, then they don't know in which direction to help you either. And that's when, you're like, I don't know if I should mention. But I think, and I have done it in the past where like I was afraid because I was like, if I tell them like what my passion is and where I want to head to, would they think that it's too rude? But now that as I'm understanding in different roles I'm going in, no, it's important for you to actually convey it, what you want, what your passion is, and what direction you want to head, because they will certainly help you in all possible ways they can.
That's so true. And really it is about building those relationships, and people are willing to help.
Yes.
Once you say, "Hey, I want to learn more about this," they're more than willing to open up their networks to you as well.
Yes.
And the growth is just phenomenal. So I think that's fantastic. And I don't want to say grateful for the pandemic, but the pandemic really did open up a lot of doors. Prior to that, we didn't have students who could go and find jobs at KHSC,
Right.
even. And I think that the need for the workforce and the understanding of the quality of service that internationally educated folks can bring into our system, that awareness just all of a sudden was realized. And we see so many folks that kind of got in during those days. Maybe they were screeners, maybe they were doing something else,
Yes.
but they're doing amazing jobs now. And
Yeah.
you're kind of pioneers in many ways. But the fact that, you've kind of gotten that experience and you've seen it
Yes.
from the ground, and having the gumption really to say, "Hey, can you help me? Here's what I really would like to do."
Yeah.
And when we hear that, it's like, oh man, here's this young person who's excited about something. Let's take that passion and let's get it directed in the right place.
Yes.
So you will get that support.
Yeah, and I apologize because I forgot to mention you earlier, is that when you mentioned about the screeners, because I started as a screener at KHSC, and during that time, ER was a very hot spot, and I was a screener of the ER for a little bit. I was again there for a brief amount of time, because I got into the next job role, right? And that's, I think, how it was. But even as a screener, the things that I learned, I was like, you understand. Again, here's the thing: is understanding how the organization works, not just in a theoretical perspective, but actually living it to know how it is, because that will open up another opportunity for you to see what exactly our healthcare needs from your level to make it better. And
That's beautiful.
yeah.
And really, you're going into that role as a screener, and it's not, I have to go to my job as a screener. Whereas here's my role in the organization.
Yeah.
Here's how I'm going to do an amazing job of it. And here's what I'm going to learn from the organization. And then all of a sudden you've got other people looking over at you going, oh, wait a minute, there's somebody who's on the ball, who, is really interested in working here, who gets it, who can do a job, fantastically. And that's probably not a word. But they're going to recruit you for something else. And that's exactly where it goes, right?
Yes. Yeah. Very well said, Julie. Yeah, that's how it works. And I think during the pandemic, even like working as a screener, right? My passion was because I was like, I don't want to stay home. I hear the news that, we're not having enough staff. I can't work on a clinical, in a clinical setting as a clinician. That is okay. How can I still help the healthcare organization to just reduce the stress that they're going through right now because of pandemic? So that was one of the things. I'm like, I need to take this opportunity. There has to be something out there that, that I can get that job. Like, it's, yeah. So I think that's another thing. It's just that feeling like, I can't use those skills. That is fine. I still have other transferable skills that I can use within this position. And I think it was just that was the time that, it was supposed to happen to me. But I could have just turned down the job as a screener, thinking, oh, that's not for me. But no, I would still say that I am grateful that I had that opportunity, because I couldn't have done it in any different way.
And again, that adds to your experiences that you just put into that blender of life that you have that may help with a process improvement project down the line. You never know.
Yes.
Excellent. All right. I know we've had you in to talk to um, new students when they're coming in and current students about kind of what to do. You've been absolutely fantastic in working with other people. Right now, what's your top advice for students who are just joining like a college program? They're just starting to learn about the system.
I would say trust your gut. And you have to pave your own path. You know, because when you pave your own path, every step you take is a lesson learned. And that just keeps adding on to making you a strong and a resilient person. And resiliency is very, very important because in it, and I'm just saying this like I'm really, oh my God, but being resilient is very important because again, it brings the best out of you in the worst possible situation. I just can't say it enough because I just feel like, you having that mindset, having that positive mindset is very important, especially when you know that you have nobody around you here. It is you who have to do it for yourself. So you guys can do it. You guys can head in the direction you want to, but you have to pave your path. Reach out to help when you need. There is a lot of help available, and asking for help is not a sign of weakness. Absolutely not. Some cultural beliefs do think that asking for help is weakness. I may or may not have been part of that. However, I'm saying it's ask help. Seek help when you need it. You know, during the course or even after the course, you might find some mentors. Take advice from your mentors. Have open, healthy discussions. Respect other people's opinions. It is very important to respect other people's opinions. That's another great lesson that I have learned. You cannot grow especially in a field like healthcare if that's what their plans are, which I would assume most of them will have that plan, without teamwork. Teamwork is very important. And learn as many transferable skills as you can while you are in the course, because you have the time for that, and you can apply those, of course, during like your various projects that you would be doing. Your capstones, they look so amazing. Like if your previous students, if you've seen, they have done such amazing work. Reach out to them when when you're stuck with something, or reach out to your professors. Julie she's a great person to reach out, I would say. She was always my go-to when I was in college. I think I may have sent her a lot of emails.
And I didn't always have the answers, but I usually had a direction to send you in.
That is correct. That is absolutely right. And I think just sending you that email when I'm thinking about when I was a student, that was a relief for me that, I was at least able to get it to her. Now she will tell me, right? So reaching out, I think seeking help is also one of the main ones. And I think that's the advice. And, you got to pave your own path. It's tough. But those lessons learned will make it a very strong foundation.
Well, that's great advice.
Sorry.
Why would you apologize?
Oh,
My
no,
goodness.
I just feel, Julie, I'm so passionate. I'm like, we can do this. There's nothing that people cannot do. There's always a way that can be done. It's all about your approach towards it. And when you're in a moment that you just feel like, oh my God, all your dreams are just come down crashing, take a moment, take a deep breath, and just think about how far you have come. Think about all the difficult situations that you have overcome in your life. And I think that will just be a self-motivation for you to again, go ahead and paving your own path.
Wow. If this health quality thing doesn't work out for you, you do have a role as a motivational speaker. You know that, right? Excellent. I know the health quality thing is going to work out for you, though.
I think so, too. However, I think a motivational speaker, I don't know.
Wait,
I'm not really good at public speaking. That's not another weakness I'm working on right now.
I'm sure you'll be fantastic when you're ready for it. And what is there something is there something on your kind of to-do list or a time on your chart for the future that says, "Hey, Molly, you made it." Have you reached that yet?
No. I feel like I always have it. Like, after I graduate from my master's, I'm gonna say, "Hey, Amoli, you did it." But I'm pretty sure when I'm reaching there, like, I'm like, okay, I gotta set up. I have another things planned for me. Like, um, I feel like I already have a couple of things aligned that I want to still do after my master's. So, yes, I reach there, but I feel like I don't get to enjoy that moment as much because I'm like, okay, now I'm ready for the next step. Now, let's do something different now. Um, but I don't think I have that set thing that, oh, once I'm done with this thing, oh, that's it. Like it's a full stop. I'm just going to enjoy. I don't think I have that yet.
That's your continuous learning
Yes.
gene that's coming out, and your absolute desire for quality improvement. There's always something. There's always a better way. There's always something more you can learn. But again, take time to celebrate those big wins because you've had a lot of them already. From that first landing here, your first impression of Canada, you talked about one,
Yeah.
and you've had many, many, many of them so far. So take that time to relax as well. But
Yeah.
I know I'm going to be coming back to you to talk to you in the future as you're serving as a director of this or a director of that, or really leading the space in quality improvement in healthcare. And I really appreciate the time that you've taken today to talk
Thank
to
you.
me and to our audience. Are you open to folks reaching out to you? And if so, how would they do that?
Yes, of course. They can reach out to me on LinkedIn. I'm usually on there most of the time, so that would be the easiest easiest way to reach me. I do apologize. I may not respond right away. However, give me some time, and if I don't respond within 72 hours, just send me another message or yeah, and I'm
Cut the
happy.
girl some slack. She's got a full-time job and a part-time study,
Yeah.
so.
But yeah, I'm always happy to help in any possible way I can. I'm always
Perfect.
here, and thank you for having me. It has been a pleasure to share my experience, and I hope that would help other students as well.
Thanks so much for tuning in. I hope the information shared today helps you in your journey. If you haven't already, be sure to subscribe to Crossing Borders on Spotify, iTunes, or wherever you get your podcasts. And if you're so inclined, rate this show or provide feedback in the comments. You can always find more information at profjulie.ca.